Parker.
Parker, she's recording this. Hello, Mr. Alatorre. I'm Tamara Clark, and I go to Arkansas State University BB, and I'm doing my demonstration speech. Hello, my name is Tamara Clark, and I will be showing you a demonstration speech on how to give injections. According to dailyco.net, over 32,000 cattle were infected with tuberculosis this past year. If those cattle were properly injected with their vaccine, that would never happen. And so today I'm going to show you how to properly inject. First, you start out with a syringe, and you properly remove it. And after it's removed, you want to make sure that you pull the plunger all the way back. And you will take your medicine, and you'll stick the syringe into it, and turn it upside down and push it all the way back up to make sure that there's no air in the syringe. And then you'll pull back until you have 1 cc and just a little bit past it. And you'll flip it back over and pull out. And when you do this, you'll see that there will be air bubbles, and you have to thump the air bubbles out so that none of them get into the skin. Once that's done, you push up just a little to make sure that it comes out. I will be showing how to get these into the oranges because of the way that the skin is on an orange. It represents an animal more better. And the first one I will be doing is intradermal, which means it is into the skin. And so you stick it in until you feel it where it goes all the way in, and then you slowly push it in until all the medicine is injected into it. And then pull out. After giving the shot, you want to make sure that you properly dispose of your needles and put them back in their cases. The second shot I will be giving is an intramuscular, which goes all the way into the muscle. And you will put it back in just like the other one was, and you pull all the way out and into the medicine. Turn over, push all the way in, and then pull out to 1.5 cc's. Make sure there's no air bubbles, and then inject it into your orange again. And this one will go straight in all the way, and you do not have to put this one in at an angle because it goes right into the muscle. And you inject that one all the way in. And then you properly case off your needle with that one. The third one I will be doing is subcutaneous. This one goes between the skin layer and your muscle layer, which is called the subcutaneous layer. You will put it in just as so, push all the way in, and pull back out. This seems like one of the more trickier ones to do because you have to make sure it's perfect. Now when you actually give these shots to your livestock, when you put in, you have to pull out and make sure that there's no blood coming out, because if there's blood coming out, you have to dispose completely of the needle and start all over. So when it's into the subcutaneous layer, there should be no blood coming in. And then you push all the way in. And this is a harder one to push the medicine through and let out. After doing so, you can now cut open your orange and see where all your vaccines went in. Okay, and then my pink food coloring was my intradermal, which is all the way in, as you can see here. And then the green was a subcutaneous, which is in between the skin and the muscle through that subcutaneous layer. And then the blue, which is on the other side, was your intramuscular, which is all throughout the muscle. Thank you.